Hey everyone, I'm back. Debbie Reed here, Think Healthcare Solutions, Trust About Healthcare, and the Health Tooth Academy. This is episode 24, Ask a Frustrated Nurse, and I'm here to discuss the White House brief that came out yesterday following up to Biden's April 5th executive order on strengthening access to affordable quality health care coverage with directed federal agencies to take action to reduce the burden of medical debt. So on one hand, has some good things to it. On the other hand, I have to kind of side with the payers, the providers that service and provide the services. Now, we have a twofold problem. The other thing is, I think in its face value, this is just another push to say, hey, America, look what we're doing. We're looking out for the underprivileged, and we're going to take care of you, and we're going to do this, which I do like the fact that they are going after basically our FICO scores, and that what this is saying is that it shouldn't weigh as heavy and keep us from our credit, such as buying a home or getting business loans or the like. However, I am going to say we, the consumer, needs to be responsible. So if in fact, because a lot of times these bills are small, and a lot of times they're big, and it's a double-edged sword, because yes, they should go after these balance billing entities that are continuing to balance bill after the payers are done, after everything's all said and done. They're still balance billing beyond a contractual agreement on the insurance. So that should not happen, hands down. Now, some of these bills, I will say that if everything's all said and done, and I'm going to simplify things, let's say you owe, you went to the doctor, you went to a specialist, and the bill was $275, and you haven't met your deductible yet. If you get a bill for $275 and you've not paid everything towards your deductible, you owe that $275. Is it fair to let that go to collections? No. Now, if you use your insurance and you go and have a procedure done, a CT scan, whatever, and you have a $5,000 deductible and you've only met maybe $800. If you get a bill for $1,200, is it fair that bill doesn't get paid? Probably not. Now, you could have gotten an MRI for less, $450. But the problem is, a lot of times we have taken on these high deductible plans because the insurance premiums, and I agree, are outrageous, and we're forced into, I can't afford any more than this high deductible plan. But we, the consumer, aren't ready and prepared to pay out the high deductible. I mean, if something hits us, if we go into the emergency room with abdominal pain or whatever, and it requires surgery, then at that point you're going to end up owing that deductible if you've not met it. And we're not always prepared for that burden. So it's a double-edged sword, to be fair. I know that a lot of consumers, and I've heard it multiple times, that they're like, they can bill me, I'm not going to pay it. Is that fair? Because unfortunately it's a fee for service. And until we can realign and totally refix healthcare to make it more manageable and sustainable for everyone, I say it needs to be totally realigned. We can't just keep putting stuff on top of stuff. And this is a prime example. While I commend I've always said the FICO, that shouldn't weigh the same as everything else, because, you know, if you're pregnant and you have a baby, and you know the baby's in the, you know, in the NICU for months on end, you know, one can only imagine. A lot of times there's avenues depending on, and I agree, depending on how much you make, and all of that stuff weighs heavy. But do not throw the Black and Hispanic households are more likely to hold medical debt than the white household, because I don't care what the Census Bureau says. Most of the time, that is, they're more likely to be absorbed into some type of charity payment plan. Yeah, sometimes they do have a balance, I will admit, but you know, and I know that things like anesthesia providers, you know, it is frustrating to have an anesthesia provider that will not work with you. That they bill, they're one of the crazier billing entities on the planet, and they won't take a cut, and I don't understand why they won't cut a better deal for somebody that's willing to pay cash. Not always. There's some really great ones out there, but they do tend to be a higher bill than, in contrast to like the surgeon. I don't know why they think that they deserve more than the actual surgeon. Yes, they put the patient to sleep and they take on that responsibility, but I've never really kind of understood that. So, you know, it's all broken. There's no way of getting around it. And while I commend the FICO score part of the whole thing, it's just another, hey, look what we're going to do for you, but it's another type of Band-Aid. So, consumer, be prepared, be ready. If you have a high deductible plan, I can't encourage you enough to reach out to us, and we'll show you what you can do, and make sure that we're not paying these debts that aren't accurate. I can't imagine how many of these shouldn't even be in the first place. So, or there's an error or whatever. So, and I see it all the time. Payers make mistakes, insurance companies make a mistake, but nobody really addresses it. You know, patients will call up and say, hey, this bill's wrong. And they're like, no, it's not. And no one gets anywhere. So instead of someone calling up and saying, this bill is wrong because it's coded wrong, or it's already been paid, or per contract, there's no balance here, what are we doing? There's so many different levels that will reduce this medical debt. And I encourage you all to reach out and let us show you the way. On that, have a great day and take care.